All patients who are detained under the Mental Health Act need to have an approved clinician responsible for their care. And in 2007, when the Mental Health Act was reformed, it was changed so that other professionals, as well as doctors, that psychologists, occupational therapists, nurses and social workers, could train to become approved clinicians. And for short, we call that multi-professional approved clinician MPACs. It's really helped me with my career development. I've had opportunities to become a senior clinician and to have a patient-facing job when usually that's not possible for nurses. And what it's done is it's created opportunity for me to work alongside nurses, junior nurses, to empower and encourage and role model and work very closely with families and patients and to make a difference to their care and their treatment. And it's really makes me happy. It makes me want to come to work.
I'm based on our dementia ward, Holbrook. So I work with people living with dementia with complex needs. There's another consultant on the ward who's my psychiatry colleague. We work really closely together. We share patients depending on patient need. That relationship is really collaborative, always thinking about the patient and involving them in all the decision making. It benefits patients in terms of patient experience. It benefits families. I've really noticed it being positive for staff. I think it really empowers them. Having other professionals other than medicine, inviting them to share their opinions in multidisciplinary teams. I think these new roles really help to promote kind of curiosity and creativity in teams. And that's particularly important for somewhere like Holbrook, which is a dementia ward, because the treatment of choice wouldn't be medication or antipsychotics.
I really enjoyed mentoring Jackie because it was a learning experience for me too. Apart from explaining things to her regarding the Mental Health Act, it also made me see that there was different opportunities for patients to have a different professional involved in their care. And also mentoring her meant that I could see things from a different point of view. I learnt a lot in the mentoring process, and I would highly recommend it to any of my consultant psychiatry colleagues to consider mentoring a multi-professional AC. Our vision is to ensure that patients have the opportunity to have the professional that will meet their needs involved in their care. So to this end, as we have done for the last few years, we will be supporting people to undergo the training to become multi-professional ACs. This is part of our workforce plan and workforce strategy going forward. It's also part of our strategic aim of making Oxleas a great place to work, because it then means that people have a route for career progression as well, in addition to providing support for patients. I'm the Senior Responsible Officer for Great Out of Hospital Care, and great care means that you try and meet the needs of your patients, and we think that working with multi-professional ACs is one way of achieving that too.
So to become approved, colleagues need to compile a portfolio demonstrating the 8 competencies as outlined in the Mental Health Act, and we do that by supporting people to get an experience in clinical environments where they look after people under the Mental Health Act. And once they've compiled that and they have sign off from their workplace mentor and their clinical director, this gets submitted to the London Approvals Panel for review. How to apply is to discuss it with your line manager and your clinical director, and we'll soon be publicising a policy that we've put together with an application form that will then be reviewed and discussed with the steering group, the multi-professional AC steering group, when we think about support for colleagues, because we want people to be successful. And as part of that support, I'm the Oxleas lead. And so I would be happy to just chat to people who are interested, to support them with the process. And we run or host on behalf of London a multi-professional AC forum where we have monthly meetings and updates, and we provide support And so if people are starting on the journey of putting their portfolio together, they're welcome to join that, and we will support them. Oxleas is a good place to work, and if you're a nurse and you're really keen to develop in multi-professional AC, then Oxleas is a fantastic place to come to do that.